Good afternoon, Mr. Speaker. Good to see you, Mr. Speaker.
You too, sir.
Thank you, Mr. Speaker. I rise in strong support of this amendment. I want to thank the good chair and the ranking member for working on this, and I've heard about the public hearing you had, and I want to thank you all for the work, the diligence in bringing this out, and I'm glad that in the waning hours of this session, somehow this important bill was not called. I was worried about that, and I'm glad to see it make the floor of the House. Through you, Mr. Speaker, a few questions to the good chair of the Human Services.
Please proceed, sir.
Thank you, Mr. Speaker. Through you, Mr. Speaker, the good chairwoman talked about more than one area a few times in her conversation with my colleagues on this side of the aisle. Through you, Mr. Speaker, could the good chairwoman expand on what that more than one area she was referring to? Thank you, Mr. Speaker.
Representative Abercrombie.
Mr. Speaker, I apologize. Could the representative repeat that? I didn't understand the beginning of his question. Through you, I apologize.
Representative Srinivasan, could you repeat your question?
Definitely, sir. Through you, Mr. Speaker, in the conversation with my colleagues on this side of the aisle so far, on numerous times I've heard you mention more than one area, and I wasn't sure what the good chairwoman was referring to when she kept saying this applies to more than one area. Through you, Mr. Speaker.
Representative Abercrombie.
Through you, Mr. Speaker, I think what we were talking about was the claims process. So every provider provides a different type of service. So, for example, the sampling that you would use for dentists would be very different than the sampling that you would use for pharmacy. So I hope that answers your question. Through you, Mr. Speaker.
Representative Srinivasan.
Thank you, Mr. Speaker. I think it does, and maybe as we continue this conversation, areas that I was not clear about so far, I'm sure we will get to that, and clear up what this more than one area is about. Through you, Mr. Speaker, this sampling size, which is very critical, in this bill, in this piece of legislation, do we make any changes to the sampling size? Through you, Mr. Speaker.
Representative Abercrombie.
Through you, Mr. Speaker, no.
Representative Srinivasan.
Through you, Mr. Speaker, then who determines what the sampling size would be, A, for a dentist, and B, for a medical provider? Through you, Mr. Speaker.
Representative Abercrombie.
Through you, Mr. Speaker, the criteria that's used is that they're a Medicaid provider. It isn't different from provider to provider. Through you, Mr. Speaker.
Representative Srinivasan.
Through you, Mr. Speaker, the extrapolation formula, is that any different through this piece of legislation than what already exists? Through you, Mr. Speaker.
Representative Abercrombie.
Through you, Mr. Speaker, no, not the extrapolation itself, but giving the providers an opportunity to work if there is an error found, because this is the clerical, we are talking about clerical errors. We're not talking about fraud here. Through you, Mr. Speaker.
Representative Srinivasan.
Through you, Mr. Speaker, it is very important for everyone to be clear that it is only clerical errors that we are talking about. And as a good chairwoman mentioned to one of the previous representatives, that if it was fraud, which is what is being concerned, obviously that is going to fall into the hands of some other agency that will review fraud and see what needs to be done. So through you, Mr. Speaker, the sampling size, the extrapolation formula from that sampling size does not change through this legislation. Through you, Mr. Speaker.
Representative Abercrombie.
Through you, Mr. Speaker, no.
Representative Srinivasan.
Through you, Mr. Speaker, when we refer to clerical errors, which is what the subject matter is in this piece of legislation, I want to understand clearly what these clerical errors are. Through you, Mr. Speaker.
Representative Abercrombie.
Through you, Mr. Speaker. So, for example, let's take pharmacy, for example. They get a script from the hospital, and there's a doctor's ID number on it. say the doctor's ID number, because we have a lot of doctors that come into the state that practice at our hospitals that are not state, they don't live in the state, so they're given a number. Say that number is not accurate, or there's one number that's off. That's what we would consider a clerical error. Through you, Mr. Speaker.
Representative Srinivasan.
Through you, Mr. Speaker, I want to thank the good chairwoman for that clarification. I was not aware of that situation where, out of state pharmacists come in and they need a number. I'm thinking of it from dentists who are in practice in our state, and obviously private care providers, the physicians who practice in our state as well. So when I think, Mr. Speaker, of a clerical error, I'm thinking in terms of documentation. The patient comes in on one day, on June the 3rd, on Wednesday, June the 3rd, and the documentation says by mistake June 2nd. Through you, Mr. Speaker, are those the kind of clerical errors that we are referring to here? Through you, Mr. Speaker.
Representative Abercrombie.
Through you, Mr. Speaker, yes, they could be considered clerical errors. Through you.
Representative Srinivasan.
And through you, Mr. Speaker, when the documentation is erroneous, but only technical, in as much as the patient did arrive, services were rendered, but it was a clerical error. So would those all be included or considered in terms of the sample size and the extrapolation, or those would be given credit in as much as it was just a pure technical error? Through you, Mr. Speaker.
Representative Abercrombie.
Through you, Mr. Speaker, yes.
Representative Srinivasan.
Through you, Mr. Speaker, when this audit is done, and as I'm sure the good chairwoman knows, we've heard so many of our dentists over the years come to us and plead that we look at this piece of legislation because it is so difficult for them to continue to practice because of the way the documentation, the way the sampling size and the extrapolation. One of the concerns, Mr. Speaker, that I've heard repeatedly is when the audit is looked at, yes, the clerical errors are referred to in as much as the services rendered, but rendered on a different day, the services rendered, but at a different location, because a lot of these dentists have multiple sites, and so do a lot of physicians. So it is my understanding those would be looked at in a different light because it's just a clerical error in terms of documentation. But through you, Mr. Speaker, will this audit also look at that particular service, if that service that was provided, was it that service was done, was documented, the documentation is there, but could the audit opine that that service was unnecessary, was not required at all, though the documentation is there? Through you, Mr. Speaker.
Representative Abercrombie.
Through you, Mr. Speaker, that's part of the audit process, but we're strictly talking about clerical errors here. Through you, Mr. Speaker.
Representative Srinivasan.
Through you, Mr. Speaker, and that is the part that I want to make sure that I'm clear about. There is one component of clerical error which we all understand, and clerical error would comprise of a wrong date, a wrong location, and at times no documentation at all. The procedure is done, the procedure is billed for, the visit is done, the visit is billed for, but there's no documentation at all. That's an error. Not fraud, but an error. And I understand that. And obviously that will go into the sampling size and the extrapolation. But my concern through you, Mr. Speaker, is will the auditor or the group of people that audit, would they have the capacity and the depth of knowledge on the subject matter to tell that particular dentist or that provider that this service that you rendered, this crown that you did, this filling that you did, this particular procedure you did in the office was unnecessary and therefore cannot be billed? Through you, Mr. Speaker.
Representative Abercrombie.
Through you, Mr. Speaker, yes.
Representative Srinivasan.
Through you, Mr. Speaker, for a person to say that particular procedure was unnecessary, though documented, there's no question of documentation. Obviously, the auditor needs to have a background, not just in auditing, but in dentistry and in the medical world. So who would be conducting, or what is a group of people in terms of depth of knowledge who would be conducting this audit? Was it a panel, and what is their depth? Through you, Mr. Speaker.
Representative Abercrombie.
Through you, Mr. Speaker, what we address in this bill is that we want to make sure that the person that's doing the audit has a knowledge in that field. So, for example, you want to have somebody that has a background in dentistry to be auditing, to be part of the process of auditing dentists. Through you, Mr. Speaker.
Representative Srinivasan.
Thank you, Mr. Speaker. And just a few final questions, Mr. Speaker.
Just a few, sir.
Thank you, Mr. Speaker. Lines 54 to 57 talks about 36 months in line 54. Through you, Mr. Speaker, how did we arrive at that 36 months? Through you, Mr. Speaker.
Representative Abercrombie.
Through you, Mr. Speaker, this was a request through DSS. Through you.
Representative Srinivasan.
Through you, Mr. Speaker, did the request specifically say 36, or did it give us a range and we chose to pick 36? Through you, Mr. Speaker.
Representative Abercrombie.
Through you, Mr. Speaker, I apologize. It was clear that they wanted 36 months.
Representative Srinivasan.
Through you, Mr. Speaker, while I'm looking at numbers from 36, I moved to lines 76 to 78, and in 77, we look at 2.5%, and that is the methodology used. Through you, Mr. Speaker, who arrived or who suggested that 2.5%? Through you, Mr. Speaker.
Representative Abercrombie.
Through you, Mr. Speaker, this was a compromise between the providers and DSS. Through you.
Representative Srinivasan.
Thank you, Mr. Speaker. I want to thank the good chairwoman for her answers. We've all had a long day, a long night, and I'm sure we're looking at the clock to see when it'll be midnight. And I want to take the opportunity to wish her a very pleasant and a wonderful summer. Thank you, Mr. Speaker.
Thank you, sir. Representative Zupkis.